metabolic dysfunction. When metabolism isn't working optimally, the human body isn't working optimally. And it can be linked to numerous physical and mental health conditions. You would expect that with more treatment, we will have lower rates. Tragically, we don't. People are really suffering. Some of them are dying. What we're doing isn't working. The right advice isn't eat less and move more. Humans will eat when they're hungry and they will stop eating when they are full. The right advice is to understand that science.
I'm delighted in this episode to introduce Dr. Chris Palmer. Many of you will know of him because he's written a great book about brain energy. So great, in fact, that over 1,000 glowing reviews on Amazon. Chris is a psychiatrist at Harvard Medical School, and he's at the spearhead, the front of a movement at the moment for everyone to start looking at most psychiatric conditions, also things like ADHD, anxiety, depression. And he wants to start looking at it through a different lens. A different lens of, think about it this way, the brain is only 2% by size of our entire body, but takes up 20% of the energy. Chris says, why do we, the second we have a condition that's above the neckline, why do we stop thinking about metabolism and how the body uses energy? Because it stands to reason that if this is 20% of the energy of the body's requirement, that maybe a lot of the conditions we talk about are metabolically led, as opposed to neurologically different. Anyway, in this episode, you can hear from Chris. I hope you enjoy it, and I hope it answers some questions for you.
Chris, I think the thing that fascinated me from your speech is that you touched on the fact that, trauma can lead to some neurological conditions. But so much in the UK seems to be the main focus that everybody keeps trying to dive in the past, certainly kids that have had trauma. But everybody keeps overlooking this metabolic link. In a way, probably in a bit more layman terms than the audience we've just been speaking to, talk about how we can look at metabolism and exercise and diet for various conditions.
So the way that I think about it is that if we even just stick with the trauma, so trauma increases risk for a range of mental health conditions, not just PTSD, but also depression, anxiety, personality disorders, eating disorders, psychotic disorders, addiction, all sorts of disorders. But trauma also increases risk for obesity, diabetes, cardiovascular disease, and premature mortality, and autoimmune conditions, and all sorts of things. So trauma can be a root cause. Talking about the trauma is not necessarily addressing the cause.
Yes. Yeah.
And so if somebody can talk about the trauma and completely heal and recover, I'm all for it. That's great. But the majority of people who are experiencing consequences of trauma will not heal and recover from talking alone. They will also not heal and recover from taking medications alone.
Yeah.
So if you can understand even a tiny glimpse of the science, then you can start to use nutritional strategies, exercise strategies, sleep strategies, and others. But it's also really important to pair it with not using substances that reduce your symptoms in the short run. Mm-hmm. So people with trauma are notorious for drinking alcohol, using marijuana, using other substances to numb the pain. It's understandable, but they need to understand that they're actually making matters worse by using these substances.
Symptoms, not curing the problem.
They're actually making the metabolic problem worse, even. If you get into the granular cell biology, you're digging yourself, you're digging a deeper hole for yourself to get out of. And so helping people understand that, but then we can't just leave people alone. Mm-hmm. We need to give them tools and strategies to cope. We need to give them tools and strategies to heal and recover, but we can do that. And for some people, it is as simple as movement, exercise, staying off screens, getting good sleep, avoiding harmful substances, and potentially improving their diet.
It was fascinating. Sorry to cut across it.
No.
It was fascinating. I don't know if you've ever seen I came up with this thing called the tree of insulin resistance, and I don't know if you've ever seen this before, but loads of people use it at conferences now. In fact, Swiss Re, one of the big life insurance companies, actually now give this to most of their clients. And I'm proposing that food, wrong medication, lack of sleep, and various things all lead to one thing, which is insulin resistance. And then insulin resistance then comes out this constellation of diseases that we now see in silos, but actually are all interconnected, whether that be your bipolar disease, certain cancers, diabetes, and so on and so forth. And it was kind of what you echoed today, that you can almost link. And you took it one stage further, which was great. You talked very much about the mitochondria, and I talked more about insulin resistance as a whole, but how this whole constellation of diseases can be linked back to a dysregulation of sugar, I guess, in one sense.
I would say dysregulation of metabolism.
Okay, I like that.
And the reason I say that is because, again, so metabolism is super complicated, and it includes hormones and neurotransmitters. So we're not replacing what we know as a field. We're putting it all together. Mm-hmm. We're taking all of those puzzle pieces and putting them together. But there is no doubt. So your work, my work, metabolic dysfunction is the way I would term it. Mm-hmm. Metabolic dysfunction. When metabolism isn't working optimally, the human body isn't working optimally.
Yeah.
And it can be linked to numerous physical and mental health conditions.
That's put very distinctly. I also picked up on the fact that we certainly in the UK, maybe it's the same in America, we seem to have so many different labels now in the classroom for children, whether that be, attention disorder, it just goes on and on and on and on. And I like the way you said that quite often they'll have more than one label, but then therefore we must be looking for a common cause for all of these if people have not just got one thing, but they've got two things and three things and so on.
Yes.
Yeah.
That we need to stop with the labels. And it's just in physical metabolic health. We have labels of obesity and prediabetes and diabetes and high blood pressure and abnormal lipids like HDL cholesterol and triglycerides. And those are all different things. And some physicians will prescribe different pills for all of them. Or we can treat all of them at the same time. Yeah. They're all interrelated. Yeah. They're not distinct diagnoses. They're not distinct labels, even though they sometimes come with distinct pills. Mm-hmm. They're not distinct labels. And instead, if you use comprehensive lifestyle treatment strategies, you can get rid of all of those things. And oh, by the way, that person probably also has depression or anxiety or brain fog or other things, and we can get rid of that at the same time. And it's just, I'm not even anti-pill. Some people think that I'm just against medication. If medication is truly helping people live their best lives and having relatively few side effects and really putting illnesses into remission, I'm all for it. Mm-hmm. I welcome easy solutions. As a clinician, I can tell you very clearly, and as a scientist knowing the research, I can tell you very clearly, the pills aren't working. Yeah. They're just simply not working.
If they were working, we'd be having longer life extension, which is on the decrease in the UK. We wouldn't have a massive increase of people on depression. And, if there's less happiness, if there's less life expectancy, then the pills can't be working.
They're not.
I mean, some of them are working. Obviously, antibiotics, when you need antibiotics. And, our NHS is brilliant if you have an accident or dealing with things that you catch, the disease you catch. But anything other than that, we seem to be going backwards, not forwards.
We are. The rates of antidepressant prescriptions are seemingly at all-time highs in the United States and the UK. And the rates of depression and anxiety are at all-time highs. So at the same time that we're administering more treatment, the rates are only going up.
Yeah.
And if the pills were so effective, you would expect the opposite. You would expect that with more treatment, we will have lower rates. And tragically, we don't. And again, I say it's tragic because people are really suffering. Some of them are dying. I don't mean to be glib about it, but what we're doing isn't working.
No, absolutely. I mean, I fund something called the PHC, you may know through David. So I'm the sole funder of the Public Health Collaboration. And we have this army of 200 to 250 ambassadors going out to doctor surgeries and places like that to give the other story, because we have this pharmaceutical model that doctors have to give an audience to the pharmaceutical industry, but there's nobody else then counteracting, well, actually, for every pill, there's also maybe a lifestyle intervention or a dietary intervention. And if we're not careful, you just keep going down the pharmaceutical model that just isn't working. And one thing I'm sure you're aware of is that, I like to think about numbers needed to trick out a statin. Well, what happens to the 200 that it doesn't, I think 4 out of the 210 or whatever the numbers are, if they're relying on the pill to save them or to help them or whatever, if they're relying on that and then not making the lifestyle changes because they believe the pill's doing more than it really is. So there's a danger, isn't there, that we, not only if the medicines are doing harm, not only if they're masking the symptoms, but if they change our attitude. In other words, we're giving the responsibility to the doctor to give us the right pill rather than taking the responsibility to look at those lifestyle interventions.
100%. I completely agree. And I think, so many doctors are really frustrated. I think most of them actually think that they're giving the right advice. Mm-hmm. And they think the right advice is eat less and move more.
Yeah.
If you just eat less and move more, everything will be fine. And they see their patients coming in year after year, getting heavier and developing new chronic diseases, whether it's their weight is going up or diabetes or cardiovascular disease or mental health conditions or fatty liver disease or PCOS in women, that they see all of these chronic conditions. And I think most healthcare professionals are really frustrated. They're genuinely disheartened and frustrated, not knowing how to help. But they're often giving the wrong advice. The right advice isn't eat less and move more. Mm-hmm. Humans will eat when they're hungry, and they will stop eating when they are full. The right advice is to understand that science and help them better regulate their metabolism and their appetite and hormones so that they will then achieve a healthy weight. Mm-hmm. And oftentimes, as you and I both know, that might require a low carbohydrate diet or something else that is not necessarily just eat less. It's eat less, eat different is really what it is.
The problem with eat less is you have less energy, and if you have less energy, you're less likely to get off the sofa anyway. So that just blaming it all on the calorie model, well, it's been flawed for 40, 50 years. It'll carry on being flawed. It's changing what it is you eat as opposed to just the numbers, I would have thought.
Absolutely. And it's not even that eat less, move more is ineffective. I believe eat less, move more is actually harmful. Mm-hmm. Because, as you said, most patients will do it. They will really try. Yeah. And they feel miserable. Yeah. And then ultimately it fails. Yeah. And that makes them feel even more miserable. Yeah. Now I am just lazy and stupid, and I don't have discipline and willpower. Yeah. And the doctor is implying that to them. And the nutritionist might be implying it, and all their friends and family are implying it.
And they go to Weight Watchers and they get told it was their fault for not following that specific plan and dropping those carbs. It's just, the whole thing's fundamentally flawed.
It is fundamentally flawed, but it is actively harming people because it is suggesting to them that if you just do what I say, you'll get successful results. We have plenty of studies that suggest that is not true. Doing that method of weight loss does not result in long-term success for most people. Yeah. And I think that we can do better. I really do. I think we can do better. I think people can heal and recover. I think most people want to get better. Most people do not want to be sick.
Agreed.
And tired and brain fogged.
So if the answer isn't eat less, move more, and if it's not relying on the pharmaceutical model, give me Chris's like plain English to parents that maybe for themselves and for the children. What's the 3 fundamental things to help be healthier, both physically, mentally, and we know we can't separate the two because that's what we've been talking about. What's the 3 bits of advice? I'm not saying it's got to be broccoli, cheese, and whatever, but fundamental, what as parents should we be thinking about for ourselves and our children to change this paradigm?
So I'll give you 3 pieces of advice, but the advice is really going to be different based on whether the person is already unhealthy.
Let's go
versus
with
reasonably healthy.
Let's go with reasonable to healthy at this stage.
So
let's go
reasonably healthy, and we want to prevent any future problems.
Yeah.
Number 1.
I'm saying this because my son's standing right there.
Number 1, eat real food.
Yeah.
Stay away from ultra-processed foods. Eat real food. So make sure you're getting plenty of protein. I tend to prefer lower carbohydrate kind of foods, but if somebody is relatively active, I think they can easily eat potatoes and carrots and other things that are not traditionally part of a low-carb diet and actually be quite healthy. So CrossFit, for example, that is a CrossFit diet where they would eat not necessarily a low-carb, but a real food. Meat, vegetables, nuts and seeds, some fruit, no sugar is kind of a CrossFit diet.
Yep.
And I know a lot of people who are very healthy on that diet. So real food.
Yep.
Second thing, get adequate sleep. Many people do not. And that usually means going to bed earlier than most people are going to bed. If people really want to be healthy, go to bed early enough so that you don't have to set an alarm in the morning.
Love it.
So that you actually just wake up whenever your body is ready to wake up. And then you've got some free time in the morning. And you can do whatever you were going to do the night before in the morning.
Yep.
Or maybe you can go to the gym or go for a run or go for a walk, take the dog for a walk or whatever you want to do. But early to bed, early to rise. And then the third thing in general is I would just be aware of harmful substances. So for youth, teenagers, young adults, marijuana is number 1. Most people think marijuana is safe and fun and helps them relax. But in fact, as a psychiatrist, I have a skewed population. I have a bias because I see all of the harmful consequences of that. But I see people coming in with new onset schizophrenia, bipolar disorder after heavy use of marijuana. And it's usually after heavy use of marijuana and sleep deprivation. So, but other harmful substances might be stimulants. Some prescription medications can be harmful.
A view on vapes? Vapes are everywhere in England.
Vapes are everywhere in the United States. Vapes are not good for people, in case you didn't know. I'm sorry to be such a downer. So everybody hates me for this message because I'm like, well, you're no fun. Go to bed early, eat real food, nothing delicious. And I don't get to have any fun. I don't get to use all these recreational drugs and vapes. And like, Chris Palmer, you're such a bore.
Well, at least you haven't told them to go, at least you haven't told them to have to go running for 10 miles a day.
No. I mean, exercise is great, but I wouldn't put it in my top 3.
No,
I would actually put those diet, sleep, and harmful substances. If people are following those 3 rules and not exercising, they're probably still going to be really healthy.
Yeah.
Whereas if they're exercising and using harmful substances, they can be really unhealthy.
Yeah.
The harmful substances are just so powerful.
I loved your first point as well about real food. But look, hey, carbs aren't the killer if you're healthy. We have something called a metabolic score. So we take their blood pressure, waist to height ratio, which I think is really important, their triglycerides, their HDL, and their blood glucose. We get an algorithm. And if they've got a really good score, then as long as it's real food, carry on with the rice and potatoes, because at the moment you're burning through it. That's absolutely fine. It's when your metabolic score is low, so you've got high blood pressure, high triglycerides, low HDL. That's when you've got to go right off the carbs, and other than the green carbs, because you've already got that issue.
I agree. No, I agree. And that's why I asked the question earlier, is the person healthy or not healthy?
Yeah.
Because I think when people are not healthy, they do require a different intervention. It's not necessarily a lifelong intervention, but they require a different intervention to get healthy.
Yeah.
And then they can maybe alter their diet a little bit.
Yeah, if all of a sudden you've got your blood pressure
healthy,
down and your waistline's gone down, if you want to add a bit of rice and, that's fine.
Absolutely. Yeah.
So it's been fascinating. You were absolutely brilliant. Your book's amazing. Thank you for taking the time to go all the way over to the UK. You just say it in such a way that, well, everybody understands. And I think you're one of the leading forces in making a difference in the world. So thank you very much.
Thank you.
Thank you, Doctor.
Thanks so much.